Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am speaking with Hamna Mughal, Pandemic Response Coordinator, and Abdul Rashid Athar, Lead Community Health Ambassador at Flemingdon Community Health Centre in Toronto, Ontario. Flemingdon Community Health Centre provides comprehensive health services, programs, and support to improve the well-being of all of the communities by working together with individuals, families, communities, and organizations. How are the two of you doing today?
We're good. I mean, I should be speaking before.
Abdul, I hope you're well as well.
Yeah, I'm good too. Enjoying the warm weather today.
Yeah, today's a lovely Toronto day. I will admit I'm fairly close to Flemingdon. It is in my neighborhood, so we are experiencing the same weather, which is very lovely. I'll start us off. Please tell us a little bit more about Flemingdon, where it is located, the programs and services provided, and the communities and population that you serve.
Yeah, so Flemingdon Health Centre is a community-based nonprofit organization that provides free healthcare services and community programs to residents living within our catchment area. Many of our programs and services are provided in collaboration with local organizations, and we're situated in East Toronto and serve a pretty high density neighborhood with large immigrant and newcomer populations. And I would just highlight that we define our neighborhood as an equity deserving community, or equity deserving communities. We believe that health equity is a human right, yet many communities experience health inequities due to persistent systemic barriers like racism and oppression, which negatively impact their health and well-being. So we use the term equity deserving to really reorient our thinking on who has power over health and health equity. And instead of health systems determining outcomes for communities, we believe that communities that have been excluded should be centered in the design of health systems that reflect their aspirations and needs. So that's a pretty holistic way of explaining where Flemingdon Health Centre comes from.
Amazing. Awesome. And of course, I did mention it in the intro, but we're having this conversation as you guys were recipients of the PHAC grant funded, the funding through PHAC for the CVP-National project. And over the last 3 years, of course, the COVID-19 pandemic has presented unforeseen challenges in all sectors, and the vulnerable population and the equity deserving ones, as you did say, have been the hardest hit groups. What has been the impact of the COVID-19 pandemic for your community? How have you been able to address it, and how has Flemingdon Community Health Centre navigated providing care and services to your clients during this extremely difficult time?
Yeah, thank you. First, I think I should introduce our community a little bit.
Yes, for sure.
With a combined population of around 50,000 plus, Flemingdon Park and Thorncliffe Park together have more than 70% of the inhabitants from visible minorities. 87% of the population lives in 5+ story high-rise buildings, and 54% have annual income of under 20,000. The area had also witnessed an increase in gun violence, especially involving youth, prior to pandemic. What the pandemic showed us clearly is that neighborhoods with these markers and symptoms of systemic oppression had much higher rates of infection from COVID-19. So misinformation and disinformation was rampant because of the language barriers. People were not wearing masks and quarantining because of the risk, because the sick was not for the sick, because large family sizes are living in small apartments due to lack of affordability. Therefore, the challenges were enormous, and multi-pronged approach was required to tackle them. Our community organizations like Flemingdon Health Centre, TNO, and Afghan Women's Organization, these are the three major active organizations in this neighborhood. They were quick to realize the challenges ahead and joined hands to alleviate pain and suffering and provide relief and help in many areas like dissemination of information in various languages and connecting the needy with related resources. This included distribution of PPEs, food, mental health related supports, helping to book vaccine appointments, helping with transport, organizing information sessions, lending smartphones and tablets to those digitally disconnected, providing emotional support, vaccinating homebound at their doorsteps, bringing pop up clinics to the high rise buildings, helping with groceries, teaching how to use smartphones and tablets, conducting online exercise, yoga, and mindful sessions, and the list goes on and on. The community agencies stepped up and engaged individuals with lived experience in the community as community health ambassadors. So vast majority of CHAs represented various ethnicities represented in our communities and were well known and trusted as volunteers and community leaders. CHAs leveraged their connections to run phenomenally successful outreach campaigns. Over to Hamna.
Oh, Hamna.
Sorry about that. Of course,
Okay.
I hope you can hear the construction here. That's why
No worries. You know what? It wouldn't be a podcast about COVID if someone wasn't still on mute, because that has not changed throughout the 3 years. Go
this
ahead.
never happens. Yeah, I think that Abdul Sir here has really deeply articulated the various ways we have supported community members, equity deserving communities in the pandemic. One thing I really wanted to highlight is that in terms of living in a densely populated neighborhood with racialized and low income populations, we know that COVID did not hit everybody or impact everybody equally. So the disproportionate populations were facing a more exacerbated underlying crisis that got intensified in the pandemic. So we really needed to employ having a social determinant of health approach, making sure that it's not just about like, hey, just get your COVID shot, but where are you going to be getting grocery support or mental health support and other sort of key facets of social determinants of health. And a lot of our work has been about sort of balancing, focusing on primary care and health needs, and then also chronic health issues like cancer and such that were sidelined due to the pandemic. So I would say like through the support of like the CVP project, we've been able to make sure the community health ambassadors are grounded in not just doing COVID vaccine work, but being able to employ that social determinant of health approach. And that would be like one of the best practices that we've utilized in making sure our clients are getting the services that they need.
Absolutely. That wraparound care is extremely important, especially when so many places were shutting down and there was this very unfortunate domino effect. And as you know, because of the podcast, I've heard the story. It was, nationwide, and it was very difficult. So kudos to making sure, you had that wraparound care for all of your clients and the people in need. And you did tease a little bit my next question about being a recipient of the CVP-National PHAC funded project. Can you tell us a little bit in some more detail about the various projects and goals included in the activities and programs carried out and resources created? I will say Abdul listed so many things that you were able to accomplish, and I know not all of them might have been PHAC caused, but I'm excited to hear anything else you'd like to share.
Yeah, but there's been a significant impact of like having the CVP-National project supporting us. I would say much like how we've joined forces with other community organizations, we've received funding from few areas, but specifically the CVP-National program was able to really help us support the CHA program at its core, so the community members can get as much possible support as they need. I would say the project has mainly centered around, as I said, the health ambassadors, which we call CHAs. So if you find me saying like the term CHAs, it's just an acronym for the community health ambassadors. It's just something like people in the community are just very easily able to pick up. So I would say the CHAs are able to continually provide support to community members and provide feedback on the changing and arising issues, as I was mentioning earlier, in terms of not just COVID related, but other chronic health and mental health needs. So we've had training sessions and that have been ongoing and will continue to better support the community based on the identified needs and gaps. For example, CHAs were reporting that more community members were identifying mental health issues. So we started providing CHAs with training on like mental health first aid and how do you have a cultural competent lens and like being able to talk about mental health and wellness with community members. And I would say anecdotally, the impact has been tremendous. We are developing a database so that we can collect more data to be able to better assess the impact in more of a quantitative way. We know that when CHAs are better equipped to support the community, there is a greater impact. And we saw this in the early stages of the pandemic when at first our communities were showing very low vaccine rates. But with greater activation, as Abdul was touching on earlier, with a greater activation of CHAs, those numbers improved dramatically. And lastly, I would say, as for resources, resources are updated and provided to CHAs so they can be aware of them and provide them to community members to increase their access to care and available supports. And many of our CHAs are really well equipped to use our service database created by East Toronto Health Partners, which I'll kind of talk about later as well. They've been very supportive in helping us serve the community. So in addition, we're working with them to equip CHAs with tablets and paper resources so they can better support clients. Without that, the interactions would have felt empty. So yeah, the CHAs have been trained to support clients in accessing certain cancer screenings, like even as far as getting referrals and such. And we host multiple community health and wellness fairs where clients can actually just come to an accessible site in their neighborhood, either a school or a gym or a community center, where there's certain screening tests and vaccinations that are available on the spot. So really making sure we're actually there for the community, and we're making sure that we're overcoming the accessibility needs.
Wonderful. That's such good work, and I'm so glad that we could be a part of all of that. Include in terms of milestones and achievements, including obviously the uptake of vaccines that you were able to reach. What were you able to have achieved, and what lessons were learned during the project throughout its time?
Flemingdon Park was one of the neighborhoods in Toronto with very high infection rates. People also found it difficult to comply with the public health guidelines due to overcrowded elevators in the high-rise buildings and language barriers impeding access to the guidelines. We translated information flyers and produced video messages in various languages and shared the same over social media platforms as well as distributed door to door. Dry and fresh food packages were distributed to those in need, along with PPEs and information brochures. Virtual sessions were held in different languages to combat misinformation and address any concerns or questions. Once the vaccine were available, we reached out to the community members and not only answered their questions about the safety and efficacy of the vaccines, but also helped them book appointments and arranged pop-up clinics in the residential buildings, shopping plazas, libraries, and other places frequented by them. For seniors living in the seniors buildings and for the homebound community members, we partnered with MGH and TNO in order to vaccinate them in the comfort of their homes. We distributed Presto cards and gift vouchers to facilitate accessibility. We maintained regular contacts with condo and rental building managers, which helped us in organizing pop-up clinics in 47 buildings in the Flemingdon Park area only, where more than 1,400 residents got shots in their arms in the lobbies of their buildings. We also distributed more than 11,000 RAT kits door to door in these buildings and at public places.
Wonderful. I'm curious. I know because I'm here that MGH is Michael Garron Hospital, but the other acronym for anyone listening who might be around the country who doesn't know what it is, you say TNO?
Mhm.
Yes. What does that stand for?
That's the neighborhood organization. And they're located right here at Thorncliffe, and not too far from us. And they have lots of other sites as well. And
Okay.
they've been a great help.
Perfect. I was gonna say I know Michael Garron. I've walked by. It's around the corner. I was like that one I know. Perfect.
Yeah.
I
I mean, it
think
used to be East General, so now we've like all caught on. Yeah.
yes, yeah. Have you and your team experienced any challenges or barriers to the vaccine promotion and uptake in your community, and how have you managed those challenges?
Yeah, I would say we definitely had to contend with vaccine hesitancy in the community, but rather than seeing it as a challenge, we saw it as an opportunity to develop trust and deepen our ties with community members. We are cognizant of historical context that creates, fear and distrust. Hence, when approaching healthcare, it is really important that we're deeply mindful of the history of colonization and oppression communities have experienced at an institutional level specifically. So I would say community members have, not always felt supported due to systemic barriers. So at Flemingdon Health Centre, we approach healthcare with an anti-oppressive and anti-racist framework, which really has allowed us to foster healthy relationships and create safe spaces that are grounded in a holistic approach and really center the need of community members. For an example, we have a significant Roma population. We know it's not enough for a doctor or someone administering a vaccination to encourage them to take the shot. Hence, we have community health ambassadors with lived experiences from the community, establishing relationships that really allow the gaps to be bridged. Moreover, I would say that we've also equipped CHAs with training on like cultural competency to ensure that anti-oppressive framework that we're talking about isn't just jargon or theory, but it's practiced as a best practice daily. So it's really as you know, Abdul, who's been like a lead CHA at FHC, has seen the different ebbs and flows, and he was mentioning in terms of having a high success rate with being able to manage these challenges. It's because we further deepened our ties in the community that really allowed us to manage those challenges. And I would say like we're in a pretty good place with some of the community members that initially had vaccine hesitancy. We have like more community programs that are serving them. So yeah, it's a challenge that's been overcome, but the work continues, and there's lots of other leaps to be made.
The work always continues. You did tease this as well, but did your project involve any partnerships or collaborations? And please describe if so, and I believe there were. And what relationships, if ever, were you able to leverage to ensure that your project was successful?
Yeah, so East Toronto Health Partners, and the acronym which we usually use is ETHP, is an Ontario health team that's serving East Toronto specifically. And they're a group of over like 100 health, social, and community service providers and organizations, as well as community members who work together to improve the way people find and get care in East Toronto. And they've been extremely supportive in, providing vaccine uptake. So ETHB, helps with having vaccine clinics or nurses and resources available for clients. And I would say even stuff like housing, employment, mental health. ETHB has been key in being able to show up when needed. Specifically, I would say the mental health and the cancer screening piece, along with COVID, has been really helpful for our health and wellness fairs that we do quite, on a constant basis to ensure that services are reaching community members, and ETHP and all the connections that they have, the resources really help us ensure a successful delivery of our project.
Awesome. And of course, the entire time we've had Abdul here, who's a community health ambassador. And I would love to hear a lot more about the work of the community health ambassadors, what specific challenges and successes came with having them, elaborate, because I know you've already touched a little bit on that amazing work.
Involving peer ambassadors and community connectors brought a sea change in our outreach model and played a pivotal role in the success of vaccine engagement strategy. It helped us gain the trust of the community and in overcoming language and accessibility barriers. Community health ambassadors' knowledge of the community and their relationship as community leaders proved to be a great asset. The challenges faced by us were enormous. The biggest challenge, in my view, has been the widespread misinformation about COVID-19 and apprehensions about the safety and efficacy of the vaccines. The second biggest challenge was the high number of people in our community who were in dire need of help due to issues like loss of job or loss of a loved one, food insecurity, anxiety and depression, and lack of access to the related resources due to language barriers. I have already mentioned how we stepped up to address these challenges. There are many success stories to share. I will share just one due to time constraints that stands out. In December 2020, I received a call from a lady who had lost her husband and her son just in the span of 6 months. Her husband, he had cancer and he died because of that, and his son met an accident and lost his life. This lady was traumatized and crying all the time. She was prescribed antidepressants by her family doctor, which she had discontinued after 3 months because she said it wasn't working. I have had conversations with this lady about 24 times over a period of 6 months. I was able to connect her with an agency for groceries, connected her with another agency for culturally appropriate mental health support, and convinced her to see her family doctor again so as to get a prescription if needed. By July 2021, she was regularly taking medicines prescribed by her doctor. She also got COVID-19 vaccine, which she was previously refusing because she said, I have lost my purpose of life. I don't want to live anymore. And she had started taking better care of her sons. She was now back to some sort of normal life and appeared to have accepted the reality of moving on in life despite the death of her husband and son. So this was just one such story. There are so many. And believe me, during these times, we community health ambassadors, after listening to so many sad episodes and stories, we ourselves were feeling not only the burnout, but also a sort of mental state where we thought that we needed some sort of advice in order to overcome such state of affairs.
Oh, thank you so much for sharing that story. That's a very poignant way to say the weight of the work that you're doing, as well as the weight of what the realities during COVID, because it wasn't just people losing their family members due to COVID. It was the reality of the world going on throughout a pandemic happening at the same time, and how all of those unfortunate circumstances seem to intersect in such very awful ways for so many different people. What a touching story. But I mean, a nice enough result in the end that, community health ambassadors were able to pull through, and that you were able to, give her the resources and help that she needed. And I really commend your work, which I already was doing anyway, but that story really, hits at home.
Yeah, it's really, I was just going to add to that. No, sorry. I think that one of the things that we're learning through the community health ambassador work is that it shouldn't just be seen or experienced. Any sort of peer health model shouldn't just be time limited to COVID. And we can really see there's a crisis in healthcare, and having a model of like peer health ambassadors, community health ambassadors, really allows you to successfully intervene in the community around health needs and any sort of social determinant of health needs. And the model that we like to call the community health ambassador work is by the community and for the community, which really allows us to successfully meet our goals. And I would say that another thing is we're meeting people where they're at, right? So it's ensuring that if there's inaccessibilities to, you know, not even having a health card, or having a language barrier, or having some level of distrust, or not certainty around navigating the health system, meeting people where they're at really allows you to put the framework of nothing without us, and nothing about us without us. And I would say that these are like the key engagement community principles that really drive the CHA work. While obviously it's not innovative and such, but it's often forgotten. And the void between people and the care that they need is often quite deep or vast. And I think that the program quite simply builds the bridge between the two. So it might not be like another not so novel approach, but it's really about just also working together. And it sounds simple, but creating partnerships, like we have ETHP, we were mentioning TNO, like allowing that cohesion to exist, so resources are widespread and they're not limited, you know, and like really making sure like we're able to reach the community, and everyone benefits from that collective energy and effort. And yeah, so I would say that what we're really hoping is we can continue the legacy of the community health ambassador work beyond the pandemic. There's obviously a lot of barriers which are related to funding, but just really finding a way to concretize this work so CHAs can be grounded in the community.
Absolutely. I've heard several other CHCs that have used, you know, community health ambassadors, peer ambassadors, that want to be able to keep that, because it is a type of connection that, while simple, it is doing so much of the work. Is you sometimes just need another person to validate your choices and hear you and be relatable, and that is really, really huge in this type of work. With new variants and the approval of booster doses, what effects have these had on the work that your center has been carrying out, as well as how the CVP-National project was working for you? And in other words, how have you been able to adapt through all of the variants and to where we are now?
Mm. I think I'll speak to a little bit on this, and then if you'd like to add something as well. I would say that because there's been like so many different like phases of like going through one stage to the other, it's about having agility as an organization, and then maintaining partnerships with various partners that we do have, that allows us to be very quick on our feet and mobile to actually go out in the community and get that information out there. And because we have the CHA Health model, that allows us to further leverage the trust that we've created with the community, that yes, you know, about 2 months ago, we were really hoping that COVID is over, but it's not. And we need to take a different approach. And it's all in the well-being. It's all for the well-being of the community as a whole. And I think that with the changing nature of the pandemic, with different variants you know, arising, it's been helpful to have that deepened connection that allows us to make sure that once the doses are out, the booster doses are out, the community is has a way to get to them. One of the things, and I think maybe Abdul here can expand on, is we had like a large COVID vaccine events where like we had buses hired, like TTC routes created, making sure that like you know, people are getting TTC tokens. So that sort of gap that might prevent people in coming out does not exist. And then like just constantly having an ear and eyes to the ground to be able to be agile, to adapt to the ongoing as I said, the ebbs and flows of the pandemic. But I'm not sure if there's anything else. I'm sure I probably missed all the great work that's happened in the past. Feels like what, 3.5 years? 3 years?
Yes, it has been. Yeah, Abdul, if there's anything you would like to add about how, you know, the adapting throughout the last 3 years has gone.
Yeah, I think two positives that we got from this COVID are, first of all, the collaboration among the various agencies, as Hamna has rightly said. Even prior to COVID, our community organizations, they were doing a wonderful job. But I think there was not the sort of coordination or collaboration that we have seen during pandemic. Because of that, I don't think we were using the resources very efficiently as we did during the COVID. So the organizations, they stepped out of their own organizations' goals, and they joined hands together. They also started doing work which which was not within their mandate. Like, for instance, they started distribution of food. Like FHC, Flemingdon Health Centre had, I don't think had done it before, but because of the large number of food insecure people looking at their needs, so FHC stepped out and started doing that. And the second one is engaging the CHAs, as we have already dwelled upon that earlier. Also, Hamna was speaking about a large event. It was Vax the East event. The campaign was launched in our area on 2 different days at the Ontario Science Centre and Thorncliffe Park Hub. And as Hamna said, transport was provided. Special buses were deployed by the TTC in order to transport people. We had a campaign of outreach. So we almost went to every building with the flyers and with the information sessions. It was a great event, and we were able to get literally thousands of people vaccinated during these 2 days. There were some giveaways also in order to attract more people, like free passes of Ontario Science Centre. They were distributed among all those who got vaccinated.
Amazing. That's such great work, and so many people in such a short period of time. That's so crucial and so important. I know all of our whole discussion has centered around this next question, but in just a more blunt way, how has the funding through the CVP-National project helped your center and the community that Flemingdon serves?
Yeah, I would say that all of the investments in the CHA program have really allowed us to scale and respond in significant ways. The CHAs provided and continue to provide a really crucial gateway for community members to access the supports they need, and in sharing vital information with organizations like ours and other service providers with what is happening on the ground and what is needed and how it needs to be delivered. And I think that as we were mentioning earlier in terms of being able to be agile to community health needs, having funding such as the CVP-National project, it allows you to sort of widen your scope of, well, there is funding for vaccine work, but in order for us to really ensure there is that vaccine hesitancy removed in the community, what do you need to do to support the community so you can actually enter in a relationship with them? And we've had clients who have struggled with getting COVID and like losing income or like not being able to safely isolate. So making sure that like the investment that we're doing in the CHA program is not just one of like, it's very simple, like outreach, hi, like get your shot. It's like relationship building, and you get invested. And that's why like it's been very crucial to connect them to resources around like a grocery gift card program, which we have been able to run in the past. And as Abdul was mentioning around like food insecurity needs through like a food bank, but making sure that like people actually are able to safely isolate, and then getting like keeping in connection with them, and making sure they can then come out to get their COVID shot, and answering all sorts of different questions. has really allowed us to deepen, like getting that form of funding has really allowed us to deepen the investment. So the legacy can continue building on.
Wonderful. And what do you think your experiences throughout the pandemic say about the ability of community health centers as a whole to adapt to emerging social and public health issues and the importance of CHCs within our health and social service systems?
Sorry, could you repeat that question again?
Absolutely. What do you think your experiences about the pandemic say about the ability of community health centers to adapt to emerging social and public health issues and the importance of community health centers within our health and social service systems?
Yeah, I would say the community health ambassador model has been a phenomenal success and must be continued in the priority neighborhoods to address wider issues around social determinants of health. And we do plan on continuing the CHA program for as long as we can have it supported. And we have found that with some new training and shifting of resources, that the model works for quite a different range of needs, from COVID-19 to cancer screening. And we really hope to continue advocating for the ongoing supportive CHA work. And I think that community health centers have been actually, like FHC or just like even other community health ambassadors, community health centers that I've seen respond to the ongoing public health needs. They have been extremely grounded in understanding that there's a plethora of needs that communities have, and you need to be able to make sure that all those bases are covered. So you're not just having, you know, like a one track mind approach, which can sometimes deter people. And as I was talking earlier about particular communities not responding to vaccine uptake, also comes from having a very rigid approach to healthcare. And I think that the innovation that community health centers employ by having an anti-oppressive framework and being grounded in community health needs, such as like providing free services to people who may not have, any sort of like citizenship or language barriers. It really allows those barriers to be bridged. And I think that the pandemic, although it has had a lot of negative impacts and it's been an ongoing struggle, and a lot of us are still recovering out of it in terms of health or housing needs or employment needs and such. But that being said, I think it's really emphasized the importance of like having a collective approach, and looking out for our neighbors and looking out for each other in a way that allows us to put our health and our needs first. I think that it's been a good reminder of what needs to be prioritized as a society. And I think that CHCs have been very constructive in sort of carving that path.
CHCs and CHAs. You were right in both instances. They both were very imperative throughout the whole thing. But of course, community health centers really stepped up when they needed to throughout the pandemic. And it's always great to hear the stories from all of our community health center members about how, they were able to step up during the pandemic. Hamna, Abdul, I want to thank you both so much for taking the time to speak with me today. It's a wonderful conversation. And I will just ask my very last question, which is, if anyone listening would like to learn more about Flemingdon Community Health Centre, where would they look?
All right, so you can go to FHC-CHC.com, and that's our website. It has plenty of resources available, from learning about how we do primary healthcare work, how do you become a client, lots of health promotion services that we have available. So you can attend, our various programming. We have a diabetes program, we do seniors programming, we have community health and wellness fairs coming up. And then there's lots of other information about our partners, specifically the East Toronto Health Partners that I spoke about. And they're going to be able to provide you with a list of resources around housing, employment, mental health, and such. So it's quite a resourceful website, and I encourage people to check it out.
Awesome. Perfect. Again, I want to thank you both so much for taking the time to talk with me today.
Yeah, thank you so much for having us. It was
Thank you.
lovely to speak.
Thank you so much for having us. Thank you.
Thank you.
Yeah, I just want to thank you, you specifically in the CVP project for being able to support us and then highlighting all the work that we've done. I think that this work wouldn't be possible without all the support that we get from our funders and partners. So yeah, we deeply appreciate it, and we look forward to more future endeavors together.
Course. I mean, I will take that thanks, even though I really had very, very minimal. I just tell all the lovely stories.
You're
But
getting all the message out there.
I will receive, and it was on behalf of CACHC, at least, it was our pleasure to be able to help encourage community and safety in this way for the past couple of years. It's weird having this project sort of come to an end, but no, thank you, and thank you again for coming on and having this conversation. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.